Thank you all for joining today's update on COVID-19 in North Carolina. As of today, we have 5,123 confirmed cases in our state, 431 people in the hospital, and 117 deaths. As with every day, our prayers are with those fighting this virus and the families and friends of those who've lost their lives. Orders to stay at home and limit occupancy in stores are in effect, as well as bans on large gatherings and closures of certain types of businesses that can't practice social distancing. And I'm sure I don't need to remind parents out there that schools are closed. But because of these measures and the good work of North Carolinians, our hospitals are not overwhelmed right now. Hospital beds, ICU beds, and ventilators are available. North Carolina has the capacity to treat patients who contract the virus. Our efforts to flatten the curve are working, and that means we have saved lives. The stay-at-home orders are working, but we know our current situation is not sustainable in the long run. We can't stay home forever. And I know people are wondering, where do we go from here? On Monday, I talked about significant efforts underway to consider when and how we'll be able to ease restrictions. Today, I want to share more about what's going into those considerations. This virus is going to be with us until there's a vaccine, which may be a year or more away. That means as we ease restrictions, we're going to enter a new normal. We want to get back to work, while at the same time preventing that spike that will overwhelm our hospitals with COVID-19 patients. Today, I want to tell North Carolinians that in order to ease restrictions, we need to make progress in 3 areas: testing, tracing, and trends. First, testing. Our new normal relies on an increase in testing capabilities to isolate and track new cases of COVID-19. This means having the supplies and lab capacity to do more diagnostic testing, as well as reliable antibody testing that can tell us who has had the virus. Dr. Cohen is bringing together partners from the public and private sector to coordinate efforts to ensure that testing is widely available across the state. And I'll let her talk more about that in a minute. Second, tracing. We have to boost our public health workforce to trace and track new cases of COVID-19. Contact tracing can be effective in containing new outbreaks, but it requires a lot of people and a lot of legwork. When a new positive case pops up, the tracing efforts will work to identify people who've been in contact so that they can get tested and take the right precautions. Our North Carolina Department of Health and Human Services will enter partnerships with universities and hospitals and others that will increase our public health workforce and get this job done. And finally, trends. In order to ease restrictions, we have to see COVID-19 trends move in the right direction. That includes trends in the number of new positive cases, the numbers of people in the hospital, the numbers of deaths, as well as how that works with the available supply of personal protective equipment, hospital capacity, and more. We know we must continue to protect our state, especially the most vulnerable and high-risk people, even after we've eased certain restrictions. Until we have a vaccine or effective and available treatment, these people are still uniquely at risk. In our new normal, we will still have to decrease the risk of exposure for older people and those with underlying health conditions, and continue strong precautions in nursing homes and other congregate living settings. In our new normal, you may see more people wearing masks or having their temperature checked. A restaurant you may go into may have tables that are only partially full. The only sporting events or concerts that you may be able to watch for a while will have no in-person crowds. A new normal can get us back to work, back to school, and back to play, but in a new way for a while. Experts tell us it would be dangerous to lift our restrictions all at once. Rather than an on-off light switch, think about it more as a dimmer switch, which can be adjusted incrementally. As we slowly bring the lights back up, we have to monitor for troubling signs of a spike in cases that could overwhelm our hospitals and risk lives. So getting this right, testing, tracing, and trends, is the most important step. It will lead to getting our state's economic recovery right, too. Sending people back to work and school while making sure recovery money is flowing to people and small businesses is absolutely essential. So are the right public health measures to give each other confidence that we can go back to our lives safely and that health care will be there when we need it. Now, I know the changes that we've all made in our lives seem to have happened very quickly. And it's important to understand that undoing those changes won't happen as fast. To protect our health and long-term economic prosperity, we have to act with care rather than haste. Like everybody else, I'm anxious to get North Carolina back to normal. But we have to be realistic for a while. There will be a new normal. As we adjust, I know that North Carolinians will continue to look out for one another as we work together to recover our economy and beat this virus. And we will beat this virus. With me today, I have our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Karen Magoon and Nicole Fox